Hand Hygiene by Kelly Osman, Renee Solom, and Haley Stevens. In medical surgical nursing, how does hospital staff performing hand hygiene compare to hospital staff that does not perform hand hygiene in the influence of hospital-acquired infections over a 1-month period? Why is this important? Compliance with hand hygiene is important in prevention of hospital-acquired infections and to prevent the spread of pathogenic bacteria. How will changes be made? Changes will occur by promoting hand hygiene teaching, the benefits of completing hand hygiene compared to not completing hand hygiene. At the unit level, we can provide staff in services routinely to keep staff members current and informed on the proper use of hand hygiene. At the facility-wide level, it is necessary to have a policy that is enforced. The policy can be reinforced with posters to prompt staff to maintain excellent hand hygiene skills. The automatic hand hygiene dispensers should be placed in patient care areas as well as in general corridors to promote the use and for easy access. Who else besides our group is interested in this topic? The facilities that provide patient care are interested in this topic. The Centers for Disease Control, the World Health Organization, and our patients and their families are interested in the importance of the staff performing hand hygiene effectively to prevent new infections to the already compromised or ill patients. C. diff is a spore bacteria. It's easily transmitted from the lack of hand hygiene. This can lead the affected patient to experience diarrhea and even more serious intestinal conditions like colitis. Patients that are most at risk for C. diff include patients on long-term antibiotics, immunocompromised patients, and elderly patients. Prevention of transmitting C. difficile includes providing diligent hand hygiene, not overusing antibiotic therapies, isolation of suspected cases of C. diff, and maintaining clean facilities. Cleaning room surfaces includes using bleach-based cleansers. CLABSIs, also known as central line bloodstream infections, are the result of a break in sterile technique and allowing bacteria or viruses to enter the bloodstream at the site of the central line, generally in the neck, chest, or groin. CLABSIs can be the result of a lack of hand hygiene, as well as other measures that are recommended in use to prevent infections from occurring. Hand hygiene is the #1 recommended preventative practice to avoid CLABSIs from occurring during placement and care of the central line. CAUTI. CAUTIs are also known as catheter-acquired urinary tract infections. Catheterization is a sterile technique, but when the sterile technique is broken, a CAUTI may result. Of all hospital-acquired urinary tract infections, 75% are from the use of catheters. One of the most important and simple ways to prevent a CAUTI is to utilize proper hand hygiene before inserting a catheter or performing catheter care, and after the catheter insertion or care is completed, perform hand hygiene again. Triggers. Problem-focused triggers include risk management data. After reviewing local hospital findings of hand hygiene compliance, we see there is a deficiency in utilization of proper hand hygiene. It also includes process improvement. That includes each facility that we utilize for this project has hand hygiene protocols in effect. Internal and external benchmark data. We have reviewed the ratings on the Medicare.gov website. This shows that our chosen facilities are below the New York State standard and national benchmarks for nosocomial infections, which include CLABSIs, CAUTIs, and C. diff. Unfortunately, WCA did score above the benchmark on C. diff infections. Financial data includes the amount of money that is spent on hand hygiene, compliance, and education. It should decrease the amount of money that is spent on treating infections that were acquired from lack of hand hygiene. Identification of a clinical problem. Hand hygiene compliance needs to be implemented at all moments of care. This will effectively protect our patients from developing nosocomial infections. Knowledge focus triggers. New research and other literature. We have utilized the Medicare.gov website to view current HCAHPS score of facilities we have chosen for this project. The data implies that hand hygiene is in use. National agencies or organizational standards and guidelines, or the Joint Commission. Standards and guidelines of hand hygiene are found on the CDC website. The compliance is monitored by the Joint Commission. They are interested in patient safety and utilization of proper hand hygiene. It is huge in keeping patients safe by avoiding nosocomial infections. Philosophies of care. Our philosophy of care in nursing is to cause no harm. This can be achieved by promoting and utilizing proper hand hygiene. Every facility is interested in hand hygiene and avoiding nosocomial infections. Questions from institutional standards committees. When is hand hygiene not utilized, and why isn't it utilized? This shows data on the CLABSIs. Brooks had no data available. Women's and Children's Hospital, also known as WCA, was at 0.544, and New York State's average is 1.00. The national benchmark is 1.2. This data shows CAUTIs. Brooks Hospital had no available data. WCA was at 0.737, which is below the New York State average of 1.066, and also below the national benchmark of 1.2. This data is for C. difficile infections. Brooks Memorial Hospital did have data that showed 0.735, and WCA was 1.111. So Brooks Memorial Hospital was below the New York State average of 0.924 and below the benchmark of 1.2, while WCA was unfortunately above the benchmark for the national average of 1.2 and the New York State average of 0.92. 5 moments of hand hygiene by the WHO. Before touching a patient, before cleaning or aseptic procedures, after exposure to body fluid risks, after touching a patient, and after touching patient surroundings. Link. Tools utilized. The Joint Commission will assess hand hygiene compliance. The CDC created the guidelines of hand hygiene utilization. The Infection Control Department at each facility will enforce hand hygiene education and utilization. Barriers. Lack of hand hygiene by healthcare workers.
This study identifies healthcare professionals' perceptions regarding hand hygiene, nosocomial infections within the workplace. The findings show that the healthcare professionals have a high level of knowledge regarding the importance of performing hand hygiene. However, it is not always performed. High knowledge level doesn't mean compliance occurs.
Study number 2. This is a qualitative study which aims to gain interest of what hand hygiene auditors do. The study found that hand hygiene auditors have a presence on the floors in the hospitals, and they observe the compliance rate of professionals within the workplace. Barriers were found to be a lack of auditors, time, and ongoing education. An increase in hand hygiene auditors may increase compliance within a facility.
This qualitative study aims to discover intentions of adherence, knowledge, perceptions, attitudes, compliance regarding hand hygiene in a hospital setting. The overall hand hygiene rate was 78%, but the goal was 90%. This shows that hand hygiene was below average. This study suggests a need for higher rate of compliance, which can be successfully achieved by ongoing education, feedback, accessibility to hand hygiene supplies.
Study number 4. The purpose of this study was to determine the nurses' perceptions and experiences regarding hand hygiene. Findings again suggest that nurses have a high level of knowledge regarding the need for adequate hand hygiene. However, compliance does not always happen. Some nurses dislike alcohol-based hand rubs due to the sticky residue and the fear of potential long-term health complications.
The purpose of this study is to observe infection prevention and control practices on a surgical unit. This study found that beds were sanitized off unit. Nurses had designed break area away from patient care areas. Staff was encouraged, and nurses did not wear uniforms home. The relevance suggests that the staff input may be very important in increased compliance regarding hand hygiene. Further areas to examine. It is beneficial to examine the compliance rates after observational personnel are placed in the hospital setting. Nosocomial infection rates should be tracked. It may be also beneficial to examine compliance rates after ongoing education and increased accessibility to hand hygiene tools. Feasibility, benefits, and risk. Feasibility, following evidence-based practice, will increase patient outcomes. Benefits, determine the change in compliance based on an observational approach. Risks, behaviors may be hard to change. Design, resources needed. However, stakeholders will be affected. Our stakeholders are our patients. They will be affected in a reduction of HAIs. Plan how to implement into practice. Signage, enforcement, ongoing education, lunch and learns, and other form of services. What are the outcomes that will be measured based on to change? Reduction in HIAs, enhanced hospital experience for our patient and their families' higher HCAP scores. Patient education reinforcement.
Teach your patients to wash their hands.
Implement and evaluate. Explain how we will implement and evaluate changes in the institution. Hand hygiene ignored in patient care areas. Lunch and learns for staff members providing direct patient care. Educating the patients and their families about the importance of hand hygiene to avoid acquiring a HAI. How will we integrate into practice? By routinely educating staff to enhance compliance of hand hygiene. How will you evaluate the process and its outcomes? Monitoring reduction of HAIs. How will you decide to adapt, adopt, or reject the practice? We will decide to adapt, adopt, or reject practice changes based on the statistics that the hospital reports into public about our hand hygiene compliance rates of HAIs. Integrate and maintain. Once we have decided to adapt, adopt, or reject, how will this EBP be sustained or maintained? Continually educating direct care staff members on the importance of hand hygiene and the proper hand hygiene techniques. How changes in communication to the stakeholders. The changes will be communicated to our stakeholders or patients and their families by signage in patient care areas and the information provided to patients in their administration packets. How will changes be integrated into policy or procedure standards? The new techniques will become the current standard of practice for hand hygiene. Continued monitoring and analysis of structure, process, and outcome. Continued monitoring will by always monitoring your surroundings and co-staff. The infection control may provide audits of hand hygiene. Analysis and dissemination of structure may be obtained by monitoring current hand hygiene practices and comparing them to rates of HIIs. Promoting EBP in the workplace. Be a change champion. By leading the way of change, maintaining compliance with change, I can influence my co-staff to adopt the changes in hand hygiene. The more positive I am about change, the easier it may be for them to allow my co-staff to adopt. Become part of the committee that changes the standards in ProCro. I can become a member of the infectious control team. This would allow me to better serve my community by being in the forefront of hand hygiene and infection control and prevention. whose hand washing video for your hand washing pleasure? Click the arrow. Here are our references. Thank you.